Dr. Kahn agreed to speak to me on money and plants a few weeks ago. And in this conversation coming up, we have a really interesting discussion about health, about heart health, about brain health, about nutrition, about all of the things that potentially can make you and me sick. One of the reasons why I started this podcast was I wanted to try and create content which would maybe educate, empower, and dare I say it, inspire you and me to make better decisions in our own life, right? And I'm really pleased with this conversation. I hope you get something from it, but not only something from it, I hope you put into action some of what Dr. Joel Kahn recommends. Let's roll the tape. I hope you enjoy it. If you want to contact me, you can reach me at connor@connordevine.com. Thank you. Dr. Joel Kahn, how are you? You're really welcome to Money and Plants. I'm in Ireland. I think you're living and working close to Detroit. Is that correct?
Correct. The Motor City, Ford Motor, General Motor, Chrysler. But we've got some good plant-based life going on here in Detroit, Michigan.
And are you still building cars in Detroit, Michigan? Is the factory still going?
It's the primary, industry, and all the world headquarters are here. So yes, and then all the companies that support it from all over the world. So we have our sports and we have some travel and we have some tech, but we are a automotive town. We build a lot of cars still in Detroit.
Excellent, excellent. Look, you're not on to talk about cars. I'm really pleased and privileged to have you on Money and Plants. I've been following your work for many, many years. My listeners know that I'm plant-based. They know that I've went through this incredible transformation in the last number of years. And I want to thank you. I said to you off camera, I want to thank you for encouraging people like me to take this pathway. But before we get stuck into it, you are an interventional cardiologist. Can you just explain what that means?
Sure. I grew up in Detroit. I went to a university called University of Michigan, Ann Arbor, famous sports school, famous university. And then I wanted to be a cardiologist since I was a child. And you have to make a decision during training. You're just a general cardiologist or there are subspecialties. And I was training right about when it really got exciting that we could find blockages and fix them without open heart surgery, bypass surgery. That's called balloon angioplasty. A lot of the companies are in Ireland for tax reasons. They make the other product, it's called heart stents in Galway. Many of them are in Galway. United States companies with, basically divisions that produce. So I got very involved with that, and it's very exciting, truly, to get that call. Somebody's having a heart attack, and maybe you're in the hospital, maybe you're at home, and you drive in way too fast, break the law, get somebody's heart attack stopped by opening the arteries. But I was actually vegan before that. I became vegan at age 18, whole food, plant-based. So by the time all of med school training and by the time I was practicing interventional cardiology, I was also a preventive guy, a nutrition guy, and I would talk to my patients. There wasn't a lot back then. I finished training in 1990, so I've been out for over 30 years. This book came out in 1990, Dr. Dean Ornish, Reversing Heart Disease. And, so I knew that there was something to this diet stuff. My patients actually were told, I fixed you today with a stent, but that didn't fix you a year from now or 5 years from now. Only managing stress, exercise, quitting smoking, and eating. And Dr. Ornish teaches also whole food, plant-based nutrition. That's the only thing that's going to fix you. So I was lucky that I've had this career my entire time. Where there was this, you have to accept there is technology, there's advances, there are drugs, but if you don't need them and you can manage it by a healthy lifestyle, obviously that should be goal number one, is never meet me or only meet me to talk about nutrition. We've already failed if you're meeting me because you need a stent,
Yeah. Okay, cool. So listen, the cardiovascular disease, heart disease, according to Google anyway, it kills about 17 million people across the world every year. It's the world's largest killer. Very briefly, can you explain three things? So what is cardiovascular disease? How does it happen? And can we reverse it then through nutrition, what we put in our mouth?
Right. And your statistic is right. So cardiovascular disease, think of it as a pie. The biggest piece of the pie is high blood pressure. That is considered a cardiovascular disease. And high blood pressure kills more people than anything in the world because it leads to heart attack, stroke, kidney failure, amputation of the legs, aneurysms. So get a home blood pressure cuff, check your blood pressure. But besides that, which is usually treated with diet, exercise, and medication, blood pressure, what we usually talk about is a different term, CAD, coronary artery disease. That's the clogging up. I always have a little model around. We're all born with gorgeous, clean arteries, and we're very prone to develop clogged arteries. Could be to the brain, very commonly to the heart attacks, bypass stents. Could be to the legs, particularly if you're a smoker. And for men, many men get erectile dysfunction. That's very often this process to the pelvis, to the groin. So yes, can it be prevented? I mean, we all start like this, but unfortunately, poor sleep, cigarette smoking, eating fast food, processed food, junk food, cheese heavy diets, meat heavy diets, sugar heavy diets, garbage. And then, stress, reaching for potato chips because we're stressed out. We shouldn't be developing this problem. About 20% of the problem is genetics. So you could actually be doing most everything right and still develop a problem with this. But for most of us, if you'll check your blood pressure, get your lab work, read, learn, follow people like you, it is a preventable disease largely, or, for many people completely. I don't say this at all to brag, but I just turned 62 and I have the technology to check my arteries, and they are clean like when I was 20. And that's not because my family history is so good. My father had heart disease early in life. So the earlier you can, your age, that you start to understand how important, how preventable diabetes, blood pressure, erectile dysfunction, heart disease, strokes are. And most of it is just common sense, but not what we're taught by our governments. Our governments don't teach us. They, at least in the States, they give companies money to make crap food, and then people get sick and the government has to take care of them through health insurance. It's a crazy cycle. We should be teaching prevent, 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 prevent.
Yeah, it's extremely depressing where we are in the world right now. It's very, very challenging on many levels, and information and who controls the narrative is appears to be key. Just wanted to ask you, is there data then in science to in terms of the connection between heart health and exercise? Then I'm sure there has to be bungs of trials done in that regard. So exercise and heart health, the science would back that up, that we should be regularly exercising. Is that a fair assumption?
And you're right, there's tremendous amount of science, looking at how many steps a day people walk. There's a famous center in Dallas, Texas called the Cooper Clinic. It's actually a fitness center named after a doctor, Kenneth Cooper, who wrote a book in maybe the 60s called Aerobics, really early in the game. Before the wrld podcast, we had Dr. Kenneth Cooper telling us to walk, to run, get gym shoes. That was before Nike, before all the companies. And he started accumulating data. And there's no doubt, the more minutes a week you exercise, the more you lower your risk of developing obesity, diabetes, blood pressure, heart disease, the longer you live. Our American Heart Association says 25 minutes a day of moderate or vigorous exercise should be the goal. You want to do 90 minutes? You want to do it 90 minutes 3 times a week, 4 times a week? It's not that big of a challenge, 25 minutes a day, moderate or vigorous exercise, a little breathless. And you feel better, your blood sugar is better, your blood pressure is better, you'll sleep better, it lowers your cholesterol. I had a very interesting patient yesterday who lost 66 pounds in the last 8 months and needed to. And I said, how'd you do it? He goes, there's only one thing you got to do: a lot of exercise and really restrict your diet. And he has chosen a plant-based diet, and it will reverse so many medical problems. He used to be on the mask for sleeping already. he doesn't need that mask anymore, the CPAP for sleep apnea. So, it takes hard work. It's easier to get fat and jolly and sick because the toxic food in our nature is to be lazy. But when you really got good health, it's so special. And I know you know that from your own health journey. We just don't we don't appreciate the miracle of waking up healthy. We got to. You got to work at it. It's not a free ride. There's no handout. There's no social security system. We're going to give you free health from the government. No, you got to work. You got to do it on your own.
I think part of my message is, I encourage people, don't be like me. Don't wait till you're sick until you change the course of your life.
Yeah.
Do it now. Whenever I'm out speaking to kids in schools, like I just share that's a good idea to do it now instead of waiting till something happens. What about this question? Because this is something I was intrigued about. Is there a connection? Have we got science to show that there's a connection between heart health and brain health then?
Yeah, more and more we're seeing, neurologists, we all say we have our own little area. Neurologists will do a research study on diet or lifestyle that helps slow down and prevent memory loss or maybe prevent stroke. In fact, there's a diet called the MIND diet, MIND, that was developed about 6 years ago in Chicago and studied that diet slows down memory loss in people at risk. Well, it's the same diet you'd apply to prevent and maybe reverse type 2 diabetes and prevent and maybe reverse heart disease. It's based on the Mediterranean diet combined with a diet called the DASH diet. Now, it's not a completely plant-based diet as it's published, but when we eat whole food plant-based, we're doing it. So the same risk factors, blood pressure, blood sugar, cholesterol, sedentary lifestyle, smoking, and some genetics that clog up our heart arteries are the same risks for memory loss, stroke. It's really almost identical. And of course, there are some heart conditions like an irregular beat called fibrillation that puts people at risk for stroke. So yes, I spend a lot of my clinic day talking about brain health to heart patients because it is the same system.
Okay, I just wanted to talk to you about saturated fat. I'm aware of saturated fat because of the work of Dr. Swank. Whenever I was trying to figure out how can I improve my health, how can I fight back against MS, and Dr. Swank did this study over 30 years, and he figured out that those patients who limit their intake of saturated fat to 15 milligrams a day tend to have better outcomes. Now that research has been buried. The people don't want to talk about it. But like I have sort of been following that, and that was part of my pathway to becoming vegan and plant-based. But then you have cardiologists, like I know you shared a stage with Asim Malhotra, who's telling people to eat cheese and burgers and pizza and all that sort of stuff. And he's like, and I don't want to dig too much into his and that kind of mentality using that, but just on saturated fat, like is that something that are you in my page? Are you in Dr. Swank's page? You're clearly not a pizza meat guy, right?
Yeah. I'm very, very much in your camp. You're right. I know and have debated Dr. Malhotra. We agree on a lot of things, like too much dependence on the pharmaceutical industry and too much excess sugar and processed food. I mean, these are universal platforms we have to teach. Cook your own food, make your own food, grow a garden. But the history in 1 minute is in the United States after World War II, a lot of guys came back with cigarettes. There was a little money around. Women were going to work and home cooked meals became a little less routine. Heart attacks started to really rise in frequency. Same thing happened in Finland, even worse in Finland. The number of heart attacks in 40 and 50-year-old men after World War II compared to before skyrocketed. So our government started spending money. Why are there so many heart attacks? Why did President Roosevelt die of high blood pressure and a stroke? Why did President Eisenhower have a large heart attack while he was in the White House? And one of the researchers amongst many was a famous United States researcher, Dr. Ancel Keys, who was hot on this topic and studied populations all over the world and made an observation, and it remains true. High saturated fat diets, butter, cheese, sausage, pastries, Lots of meat, high heart